A disturbing new study finds more than half of Chicago infants are potentially unsafe while they sleep. That's the finding of a new survey that details the problems and also has led to a discussion about solutions. We are joined by Dr. Megan Attridge. She is with Lurie Children's Hospital of Chicago. Good morning to you. Thanks for joining us.
Good morning. Thanks so much for having me.
So, Dr. Attridge, let's talk about what exactly is causing this problem. Is it one particular thing or several things?
Yeah, so sudden unexpected infant death is the unexpected death of an infant, usually in their sleep area, and it includes things like SIDS or sudden infant death syndrome, which many people are familiar with. And this is a significant cause of death of infants in the United States and takes the lives of over 3,400 infants each year. And research has shown over the years that likely many things contribute to this high number. But what we do know is that practicing safe sleep is associated with a decreased risk of sudden unexpected infant death.
Okay, and let's talk about that because your survey found that 58% of Chicago parents reported that they had placed their infants in sleeping positions that are known to be unsafe. So let's start with what is the wrong way. Let's just put that out there.
Sure, yeah. So we found, like you said, that over half of Chicago parents with infants are placing or practicing at least one unsafe sleep practice. And that includes using a loose blanket in the crib, having the baby sleep in a parent's bed with another adult, having a pillow or something fluffy in the crib with the baby, placing a stuffed animal in baby's crib, or using a quilt or comforter. And again, all of these practices would be considered unsafe for babies under 1.
Okay, so it's pretty obvious then what needs to be done for some of those, but let's go over the right way and some of the guidelines for that.
Yeah, so we, along with many other institutions, recommend that all babies be placed to sleep on their back. This should be on a flat, firm sleep surface, alone, and in their own sleep space. The mattress can have a fitted sheet, but there should be no other bedding in the sleep space. We would also recommend that parents keep baby's sleep space free of blankets, bumpers, toys, and other objects. And these other things, if you can, share your room, but not your bed with your baby until at least 6 months of age. Breastfeed if it's possible for you. Stay up to date on checkups for your baby with their pediatrician. Avoid overheating or overbundling your baby, and consider allowing your baby to use a pacifier.
So we're talking, you said up to 6 months of age. At what point do you need to start worrying about when you put your baby on their back and then next thing you know, they flip themselves over? I mean, that could be paranoia for a parent to have to be up all night making sure their baby is on their back. So what do you suggest to them? How do you want to get that message across to them?
Yes, this is a question that comes up pretty frequently. So rest assured, we recommend that you place your baby on their back to sleep. But if they are old enough to be flipping over on their own, which happens, usually around 4 or 5 months of age, you can leave them that way. You don't have to stay up all night flipping them over onto their back.
Right. Okay. So what do parents need to know? What do pediatricians need to be doing just to make sure that this message is coming across? Because that percentage of 58%, that's pretty high.
Yeah, yeah. So this is a conversation that pediatricians have routinely with parents when their child is under 1. So we recommend that if you have any questions about what safe sleep should look like for you, please talk with your pediatrician.
Okay, Dr. Megan Attridge with Lurie Children's Hospital. Thank you so much for joining us. Important discussion for parents to hear. So we appreciate your time.
Thank you so much.
Okay.